Recording from the Sunshine City, St. Petersburg, Florida, overlooking beautiful Tampa Bay, this is the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute. This podcast is dedicated to medical professionals and patients around the world interested in diagnostic and interventional ultrasound. Our podcast will discuss everything ultrasound, from news, trends, career paths, new technology, and industry updates. Hosted by Lori Green and Tricia Rio of Gulfcoast Ultrasound Institute, they bring over 4 decades of experience in the ultrasound profession and are here to guide you through this journey. Now sit back, relax, and enjoy.
Welcome, everyone, to the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute, where we talk about everything ultrasound. I'm Lori Green, and I'll be co-hosting today's episode with Tricia Rio.
Hey, everybody.
We're so happy to have you here today, and we are thrilled to have Dr. Kevin Evans, a professor emeritus and academy professor, based on his long career and accomplishments at The Ohio State University. Kevin has earned a PhD in geriatrics and gerontology, and he has extensive clinical and academic career within the university, having managed clinical units as well as the academic division of radiologic sciences and respiratory therapy. Dr. Evans continues in his role as a funded researcher and the director of the Laboratory for Investigatory Imaging, which was established in 2005 to conduct original research. So he has a great background, and we're so excited to have him here. He currently is the editor-in-chief of the Journal of Diagnostic Medical Sonography. He has also served as the chair of both the American Registry of Diagnostic Medical Sonography and the RDMS Breast Foundation. He is past president of the FSDMS, or Sonography Society of Diagnostic Medical Sonography, and the FSDMS Educational Foundation. Dr. Evans has over 250 publications, including journal articles, abstracts, multiple textbook chapters, and a second upcoming textbook. Kevin has been the recipient of the Distinguished Sonographer Award presented by the American Institute of Ultrasound and Medicine, as well as the Legacy Award presented by the Society of Ultrasound and Medical Education. So we are so happy to have you here. Welcome, Kevin.
Thank you guys so much for inviting me, and especially about this particular topic, which I am super passionate about.
Yes, we're thrilled to have you as well, and we're just honored that you accepted our invitation to be here with us. So I guess we'll just jump right in and get started. I was fortunate enough to attend your plenary session during the SDMS annual conference last October in wonderful Colorado, where you touched on the topic of moral injury, specifically due to working through the pandemic. We connected following the conference and decided the podcast would be a great platform to extend this discussion, as well as reactions that you've had to presenting on this topic. So let's just start there. Why don't you begin by defining moral injury, what it is and where did this term come from?
Yeah, Trish, thank you so much. Again, I am very passionate about this topic, and it's funny because it didn't come naturally to me. It sort of was an outgrowth of these longitudinal surveys that we have been conducting for the last 5 years. I was commissioned by all the ultrasound organizations, and I think some people know this, to start tracking work-related musculoskeletal disorders in a longitudinal way, because we have never, ever in our profession had a survey that was sequential with people to see what was sort of like where their pain starts and where it goes. Mm-hmm. So these 5 years of surveys that I have been conducting, were focused on work-related musculoskeletal disorders, but one of the surveys that we decided to add questions to was about the effect of COVID, because we all were hearing about the work challenges that people had with COVID. So that is the genesis of where this came from, is the amount of outpouring that I received through the surveys specific to what people suffered post-pandemic in their workplace. Mm-hmm. And I just like gobsmacked by what I was reading, and I couldn't even process it all. I mean, some of it I experienced in a very small way, and then some of my past students would share things with me, but nothing to the tone of what I was hearing and reading So trying to make sense of the survey information that I was reading, I was so struggling to understand make sense of what these people were trying to tell me. And so oddly enough, I was going on vacation and I'm riding in the car and I had NPR, you know, their station was playing and the speaker for NPR was talking about moral injury. Well, I was so the coincidence of this broadcast while I'm driving, thinking about how to make sense of this data. I actually pulled the car off the side of the road because I was like, this can't be happening. But this is the speaker, this is the definition that she used to define moral injury. And what she said was, it's when a provider knows the right thing to do, but constraints make it exceedingly difficult or impossible to execute the right course of action. And her broadcast was really about physicians in the emergency room that she felt and she had been studying these people and she felt that they were suffering from this. Well, I'm sitting there thinking, well, hey, it isn't just ER physicians that this happened to. I have evidence in front of me that sonographers and vascular technologists were suffering with these very same things. So for me, I felt like, oh, great, I've got a name to put to this phenomenon that I'm seeing. But when I continued listening to her, she also talked about it in relationship to what we would call PTSD. And actually, when we were going through the qualitative coding and reading all of the stuff from the surveys, we had actually applied that code because we couldn't make sense. And so we just started jotting PTSD, PTSD. So the coincidence of both the NPR like broadcast and then working with this survey data and seeing how it all fit together under this label, if you will, of moral injury, that is really where this all sort of took place. And I have just felt very passionate about how to help heal many of our colleagues because this is it's a thing. And we think about it primarily in the military when, soldiers have come home from war and they have experienced things that they find painful or they regret, which we think of that as PTSD. Mm-hmm. But the same sort of therapy that's given to them is what's now being suggested for our colleagues, because again, they were trying desperately to give quality care. But then, as you remember, all of the rules, all of the changes every day about caring for patients were these constraints that kept our people from doing something they knew was right, but then they couldn't do it. And our people are so empathetic, as you guys all know. And this was just like an arrow to their heart. I mean, they felt that they were causing the problem. And so the suffering that people have had over not being able to do the job that they felt that they were trained to do, and they felt they hurt people. I mean, it's just, it's heartbreaking to hear what they have to say. And so that's been sort of my last couple of years of passion, is how to help our community get past this. And so thank you guys for bringing this up in this podcast, because I really don't think we're done yet.
Right.
Oh, absolutely. And that's so interesting, but also sad that it actually occurred. And it's great that you've done this research and, now we can get this information out and people can, not be afraid to discuss it and, seek out some help if they should need it. So I think it would be great if you could share some examples of, contributing events that have led to our colleagues to experience moral injury.
Yeah, thanks, Lori. I mean, I couldn't even begin. We'd be here all night listening. Talk about what I've learned and what people have told me, but I've got a few examples that I think resonate really well with this. The most obvious during the COVID pandemic were all the patients that were critically hospitalized, and our folks were in the ICU trying to perform exams on them. And of course, they went with the mindset that they were going to do a cardiac echo or whatever they were asked to do at the highest level that they always do it. But the constraints put on by the hospital were all this PPE, which was important and necessary, But not only did they have all of this extra gowning and gloving to do, but they told them you could only spend so much time for personal exposure. And so the exam has to be like 15 minutes. And so they're like, how do I give this patient who is dying the kind of care that I think they need, but I'm being told I can't stay in this room? So that is one of the primary examples. I've heard this repeated and told to me in multiple ways, but it's always revolves around these ICU patients and them in their critical, the critical care that they had. And the second one is in OB. And as you can imagine, in OB, we have many occasions where we have to give bad news to patients. But again, the rules at the time were that the mom could only be in the room with the sonographer. There was no one else in the room. So whoever the significant partner was not allowed in the room. But nevertheless, the job had to be done, and sometimes fetal death was experienced. And I can't tell you how many times I've heard this story where it was just the grieving mother and the sonographer, and that's it.
Oh,
And holding this person while this woman's crying about fetal loss, the sonographer's crying. I mean, what these women experience is just, and again, it comes from their empathy. They were not going to let these people grieve alone. But, there's only so much as a person that you can take on. You know what I mean? People were going home with this, they're going home with that ICU patient that didn't get their good cardiac care. They're going home thinking about how this grieving mom was all alone and her husband was out there by himself. This is our people. That's who we are. We're just very compassionate people in this profession. And I think it made us so vulnerable to this because we took it on as like our fault, which, oh no, it was not our fault. And then the last example I will give is actually, it's a nursing example. My wife is a labor and delivery nurse. And so we have a lot of that in our, a lot of nurses come and go in our house. And so I also, know that part of the profession too. And this particular woman, I met her and she'd been an ICU nurse. And the reason I met her was because her son had been a COVID survivor, but at our children's hospital, he wasn't getting better. And so they asked me, would I come to the pulmonary clinic and do a lung ultrasound on him to see why it was that he was not progressing? So the mom, of course, was there. She's an ICU nurse that my wife knows. And so I'm scanning the boy, and he obviously had all of this pathology in his lungs, like the pleura was just like all broken. And so air was like leaking out of his pleural space because of the punctured areas in his lungs from COVID. And I'm trying to document all this. And in the background, the mom starts crying. And she starts like completely coming apart. She's just like, I was trying to take care of patients. I took a shower when I came home. I never wore my clothes in the house. I'm the one who's given my son this disease. I just had to stop. I had to stop scanning the kid. I turned around, and much like that OB patient, I just put my arms around this woman. I said, look, you are a good mother. You are a good healthcare provider. You cannot take this on. This is too much. You aren't going to make it. You got to be strong for your kid, So these are some of the examples, and I know they're sort of emotional and they're very, raw, but this is what's going on in our community. And the amount of healing that needs to happen from this, we can't move on. We can't just act like this will go away because people are carrying this baggage with them every day.
Yeah. That's a lot. Like, I think we need a minute here.
I know.
Holy moly. The one thing that kept coming through my mind is thinking about these examples you're sharing, which are obviously very personal stories that people have shared with you. And we appreciate you bringing them here so that we can put this on a more public platform, because I just think about how many sonographers or healthcare providers in general who are out there right now who don't really even understand that this is what's wrong. Like they're feeling conflicted, or they're carrying all of this, or they have some sort of, just effect from this, that they don't even realize that that's what happened. And so this is where it all begins, right? We do the research, we actually name things, then we find out how do we help people through these things. So just having this conversation and talking about the emotional aspect of our jobs is such a huge piece that I think in a daily clinical setting gets overlooked. I mean, there's just not time to deal with that in practice. So it's nice to have this and have, our broad audience who's listening to this, which is sonographers, physicians, advanced healthcare providers, patients, administrators. There's so many people that are listening to this that now are going, oh, wow, like I didn't even put it in that context. Or so, there's a sonographer sitting there right now going, well, that explains everything.
Right.
I don't feel like maybe this is validating to them. They're like, okay, this makes a lot of sense. And now I understand why I've been feeling the way I've been feeling for the last 5 years. Right.
Well, you can certainly see how that would have an amazing impact on the sonographer performing the exams, not only while they're doing it, because, I can see someone leaving, going home, and knowing in their heart that they did not have the ability to do a complete exam. And in particular, if that patient didn't make it, and now all of a sudden you're like, if I would have been able to do this, that, and the other, a complete exam, they may have had enough information to change the course of treatment for that patient, and we'd have a completely different outcome. So that's a huge load for someone to have to, carry. And the same thing, in the OB setting and a lot of other settings there. I mean, it's difficult enough when you're scanning a patient in a non-pandemic situation and they have a fetal abnormality or fetal demise or something. It's already difficult enough, but then to have to be in that situation where they don't even have a loved one with them to share in that experience. So yeah, that's really, you're right. It does tug on your heart there, on your heartstrings. But I think it is, like you said, Tricia, I think it's really, this is really amazing to be able to have this discussion, because these people now will be able to recognize that this is really a disorder that they're dealing with, but may have never, because once the pandemic started ending, basically, everybody's just like, okay, that's over.
Back to normal.
And get back to
Not
normal.
back to normal. And then think about the guilt that they must have felt if they provided care and were fearful of being around patients who had COVID or were suspected to have COVID. And maybe they personally made the decision to dial back their exposure or to put distance between them and the patient, which they know then limited their exam and the quality of their exam because of the guilt they felt about taking that home to their families. Like there's just so many different complexities of this that I never really thought about it from a broader perspective. So.
Yeah. And I think a lot of times too, especially in the general public, because they don't really know what's involved in our profession. And so they don't realize that, we're not just picture takers.
Right.
We know exactly what's going on. We know how to connect the dots and, correlate the physical exam and the medical history with what we're seeing. And we are conveying that information to the physician to be able to appropriately treat or manage that patient. Yeah. Where in a lot of situations, not necessarily the case. We have to know all these disease processes, and we need to know that. And a lot of times the average person doesn't really recognize that. They think you just come in, wave your magic wand, and you take a few pictures and be done, So, but there's a lot more to it. Like you said, we're very empathetic and compassion, have a lot of compassion for our patients and passion for what we do. And that translates into the level of quality of care that we provide. And that's huge for the patient. So it's a lot more than just learning how to scan and turn in some images in our profession is completely different. So it does put you at a completely different level of experiencing things like moral injury or PTSD and situations like this and other cases, really. Yeah.
I'm sure you have some PTSD from all of these stories.
No, actually, it's just become, like I said, a passion for me about how to help these people. I guess that's my empathy is like, I know I'm an empathetic person, so I know how this injury happened to them, but I'm just sort of hell bent on helping them get past this because the people that I personally talk to now, they, like you were just saying, they have trouble articulating what is wrong. And so when I publicly speak on this topic, people have come up to me afterward, and a little later I'll talk about some of that. But I think first step, like everything else, is just recognizing what's wrong and the right steps to get better. And so that's sort of where my empathy is how do I help my colleagues get past all this? Because now that we know what it is, what are we going to do to fix it? Because that's what has to happen. We can't lose these high quality healthcare providers to something like this.
Agreed.
Totally.
And we can't let them feel alone in it.
Right.
Wow.
Okay.
So when I was at the SDMS conference, you did the plenary session, and really the basis of that session, what I took away from it is we were focusing on work-related musculoskeletal disorders, and that's where the SDMS has invested quite a bit of time and energy into getting data to figure out why that number keeps increasing despite our best efforts to, fix it. And so, but you mentioned this moral injury and this phenomenon during that. So can you kind of relate those two things together for us and how they, interact?
Yes. So just sort of staying on this line of inquiry, if you will, recognizing that people have been morally injured or are suffering from this type of PTSD. Like Lori said, they're still going to work. They're trying to perform the duties that they know they're to do, but yet they're carrying this horrible baggage with them. So what happens is it's very difficult to think through your day. Like, oh, is this going to end up being the same thing that happened the last time? I mean, it messes with you cognitively. You can't process your normal way of working because you're still reliving some of the unresolved things that you experience. So there's this cognitive like mess up, if you will, because you can't get past what happened. You also are carrying a lot of anger. You're angry sometimes with yourself. You're angry with your hospital or clinic because of the rules that they put on you. And so you're carrying that baggage with you in the workplace. And then you're starting to like feel burned out. Like, I don't know if I can continue doing this because it's causing me to be angry. I feel like I'm not doing my job right. And so then the last downstream thing is I start making physical mistakes. I do things I shouldn't be doing. My arms are too far. I'm doing all these things that I normally wouldn't do, but I'm just not like with the program because I've got all this baggage that I'm holding on to. And so this is why we were talking about it. And it's funny because it came out of those surveys about, musculoskeletal injury, but this has become like an accelerant to it because folks aren't able to function in the workplace at the normal level that they did. So they make physical mistakes that end up giving them physical injury. So we have folks who have both mental and physical injury. And I just think this has got to stop. I mean, this is not good. So that's one of the reasons we wanted to make it, a highlight at the SDMS meeting. And at SVU, they asked me to speak on this topic exclusively. I mean, it was the main session at SVU was moral injury. So I feel really good that 2 major meetings this past year, this has been front and center. And I think it's so critically important because like you say, these things are starting to like become intertwined.
Yeah. Well, that makes sense.
Yeah.
I mean, I know when I'm distracted, the first thing to go is my ergonomics.
Oh, yeah, of
You know, like
course.
when you have a
Yeah.
difficult patient, competitive, or family in the room that are asking a lot of questions and you're distracted, and that's exactly what goes first is my form of my body and how I'm scanning.
Right.
Makes sense.
We've had enough issues as it is, just with being able to work through these work-related musculoskeletal disorders, and helping people to become educated on how they can prevent that. And then you add this on top of it, and you're right, it just kind of fully complicates the situation. So, it definitely is great to be able to bring this front and center and help get people to start figuring out we need some solutions and to work together on that. And so obviously your research is well deserved to be addressed, and as far as these conditions go. So, I mean, in your opinion, what are some of the lessons that we learned through this research that could come up with some solutions and that we can implement to prevent both the mental and physical injury?
One of the good things, I harken back to what I pulled off the side of the road and I was listening to this speaker on NPR talking about, moral injury amongst physicians. And she, at that broadcast, started talking about solutions and treatments that she was using with those physicians. So I don't want this to sound like these are my solutions, but I just took exactly what she said, and I have been trying to apply this to myself and to my colleagues. And so I just want to give credit where credit's due. This is not mine. I'm simply, sort of repackaging what I heard. And the most critical thing is something so simple. It's called forgiveness. It sounds so simple. And at SBU, I felt like I was some sort of preacher. I was up on the stage and I looked out at the audience and I just looked at them and I said, I forgive you. I forgive you for what happened. And please just leave all of that baggage here in the room. I want you to walk out of this room free of what happened to you. People were crying. I mean, it was like a wave that came over me. And it was just like the most therapeutic thing. And I know this is the right thing because of the response I get from people when I say this. And it does sound like going to church, but I mean, some people just need to be relieved of what they think they did wrong, which they didn't do anything wrong. But this is that whole being so empathetic and carrying all this so close. And when the minute they drop all this, they feel so much physical and mental clarity over it. And so I would just advocate all the people listening, and of course, both of you, when we interact with folks that we suspect are suffering, I just say, just say those words, I forgive you. And it will make a life-changing difference for them. The other thing is not only forgiving yourself, but you have to forgive the place where you work, because they were as messed up as we were, to be just quite frank with you. Because if you think about that time, the CDC and all these federal agencies were changing the guidance every other day. And the hospital leadership was struggling to figure out how to be in compliance, how to keep the workforce safe, what to do, how to do it. There was even, in our hospital, there was even something called a command center dealing with all of this. And they did get things wrong. They got some things right. Mm-hmm. But those of us who were implementing their stuff, for us to be angry at them, we need to forgive them too, because I don't, in my heart of hearts, think they meant to do wrong. They simply orchestrated something that was given to them that wasn't right. And so we have to forgive ourselves, but then we also have to forgive them for the mistakes that they made. And in the end, we can all heal together, because when you go into work and you're no longer angry at the place where you work, it makes a big difference, right? And also, when you don't feel like you're doing things wrong or you're malicious, I mean, it's just so much better of a place to be.
Yeah.
And I think a lot of folks have found that they can resume who they were and continue the job that they do once they've done these two simple acts of kindness, just forgiving themselves and forgiving the place where they work. And that will go a long, long way. And I mentioned this before, but I won't say which meeting it was. But after I had done both these meetings and said both the same things, I was in the exhibit hall trying to get to Gulfcoast. I couldn't get there, Lori, because this man stopped me in the middle of the aisle and he physically took hold of me and he just stood there looking at me. And it scared me a little bit because I didn't recognize him. And he started to say something, and then tears started coming down his face. And then I knew what it was. And I said to him, "You didn't do what I said. You were supposed to leave that in the room. Now you stop that. You leave that in this exhibit hall." And then he just embraced me. And I tell you guys, I'm having these incidences a lot with people. And it absolutely makes me know that this is a real thing. I know I've had folks tell me that work-related musculoskeletal disorders aren't real and that I made this all up and Joan Baker doesn't know what she's talking about. And I go, okay, all right, you don't believe it, that's okay. But I'm telling you, this is not a made-up thing. This is a real thing that people are really suffering. And for them to recognize what's going on with them and for us to recognize it as an organization and corporately and as a profession, I just think it's critical because we cannot lose these expert healthcare providers to something so tragic. And it is the past, but we just have to help them move on.
Mm-hmm. Well, and I think part of helping them move on is establishing not only, that forgive yourself, forgive your employer, but establish healthy practices going forward so that if you're in a situation like this again, you know what to do and you know how to handle it rather than letting it traumatize you. You can be a little bit more aware and maybe take some steps to not let it get to this point, And again, I just think it was all so fast and it happened so quickly and so much fear and changing daily, protocols and just, you're not working this week. Well, now next week you are working. We're closed. Now we're open. It was just so much back and forth. And now you have to wear this mask. Well, that mask doesn't work. Now you wear this mask. And it was just constant. And then shortages of masks and people are re-wearing the same mask for days on end. I think it was just such an overwhelming time that nobody really thought about what is this going to do to us mentally and physically. And so, again, I just think it's about taking the information that we've shared, healing, but then instituting some protocols going forward to take care of yourself and then instituting them in your department to make sure your sonographer team is taken care of and just healthcare professionals in general.
Yeah, I think it's important for the facility that you work with, department you work in, that they have to learn about this as well and figure out, what practices can they put into place to assist the sonographers with the healing process and recognize that it is a disorder. And like you said, COVID was, it was a hell of a time. And everybody felt like it was overnight. All of a sudden, your entire life changed. And the way that you just live your day-to-day life changed. Some people not being able to go to work. We were closed down for quite some time. And just being able to deal with that. And so, like you said, with the anger towards the employer, people do have to realize that nobody knew what to do. This was something that no one has ever had to deal with in our lifetime. And all of a sudden, we're having to make split decisions, and some right, some wrong. And we're still to this day, learning about ramifications of the disease, the treatments, the lack of treatments, and so forth, and the long-term effects of COVID. So that go beyond this.
Yeah.
And I think that's going to continue on for some time. But I know we've learned a lot over the last 6 years, and this is just another aspect of COVID that has to be recognized and figure out, what's the most appropriate way to resolve the problem. But you're right. I think that's a good suggestion for starting with someone that have run across that is suffering from that forgiving yourself, but also forgiving your employer, because that's where it all starts. And I'm sure there's other things that can be put in place to support the employee, the sonographer, as we move forward.
Unburden yourself.
Exactly.
Yeah. So I know when we've talked about work-related musculoskeletal disorders in the past, a big portion of overcoming those and instituting better practices requires not only the sonographer to be trained and educated, but also their employer, and then also equipment companies who are creating the systems. It's kind of a multifaceted solution. So obviously, this same thing, moral injury and dealing with it and forgiving and establishing protections going forward to make sure that it doesn't happen again, requires that same kind of, collaboration and teamwork. So do you have any advice for somebody who might be listening, who's thinking right now, well, how do I bring this to my employer? What do I do? And how do we start to implement a strategy to help us heal and to prevent this from the future?
Yes, and I'm so happy to say that we've actually had some success with some major hospital employers on this very issue. And I'm happy to say that I won't reveal the exact place because I'm just trying to be, honor those folks. But a high-level leader in our profession was so upset that she felt that her administrators and her hospital didn't understand this phenomenon, that she took the paper I wrote, which is titled All the King's Sources and All the King's Men, and she went in there, she was very aggressive, and she went into the C-suite, and she was like, this paper, I want everyone in this room to read this paper because my staff are severely hampered by this. I want you to know what it is. I forgive you, but you have to learn not to let this happen again. And major policies got changed.
Oh, I love her.
This is a major hospital system in the New England area, I'll just say. And so I really felt like that might be the biggest thing I ever accomplished was this. It was a symposia that I wrote about this phenomenon as a way to get the word out. But for her to literally take the article and hand it to these administrators and make them read it, I mean, that was pretty ballsy, I think. I don't know if I could have done that. But
she left and they all went, who was that?
We got policy and procedure change. And what I mean by that is, and that's something that I think is still unfulfilled, is that people have decided to move on and they have not done the lessons learned. And, we will experience something like this again. And we better than what we were. We can say we forgive because folks didn't know. We can't forgive again because folks do know and they have to make changes. And so I point out this particular incident where administrators were forced to understand this is just not a doctor and a nurse thing. It is a sonographer thing too, and that we need to be addressed and seen, and then policies need to be written so that this kind of thing doesn't happen again. So that's something that I feel is unfulfilled still, is the lessons learned. We know what went wrong and we know how we can hopefully make this not happen again, but we need to get this into policy and procedure. And we probably should be practicing some of this stuff, on a slow Tuesday or whatever, like everyone, like two people going up on portables together. There are some things that we can do. And also, I think bringing this up in staff meetings, because again, saying in a staff meeting, we know folks are still, hurting. What could we do? How can we help our coworkers? Just providing a supportive work environment. We think people have this, but I'm not sure they do, and especially where this is concerned. So I think there are still unresolved issues that need to be addressed. And I'll be super frustrated after all of the things I've said and all the stuff I've done if we don't get workplace change, because we have to do it. And it isn't an everyday thing, but because it isn't an everyday thing, we're likely to have somebody get hurt again. And that is something we cannot abide by. Just as much as we're trying to practice our ergonomics and making better posture position decisions, we have to equally also do that for our mental health too. And I have said to folks, if you notice a coworker who's struggling, don't walk away from them. Treat them like you treat your patient. Just demonstrate the same empathy to your coworker that you do to your patient. And it's sort of odd we have to say this because our folks are so compassionate to their patients, but they lose their patience literally with their coworkers if something isn't quite right. And that is sometimes causes there to be a hostile or toxic work environment. So really practicing what we preach, being sure that we're as loving and supporting of our coworkers as we are our patients. I think that's a nice Band-Aid to put over some of these things. But truly, structurally, we have got to make sure that stuff that we experience does not happen again. So those are some of my pearls that I, kind of wish we could still take care of, before the next thing happens to all of us.
Yeah. No, it's really good advice.
Yeah, those are excellent suggestions. And, your article, we're going to have that, it's in the show notes. So, that's a good start right there. So those of you who are listening, be sure to check out the show notes and you can get that and just walk right into your administrator's office.
Yes. Please read this. Maybe don't be aggressive.
Yeah.
Just say, please read this. I'd really appreciate it. And I do think that it just comes down to the fact that most people don't know.
Right.
Like they just don't understand. And I think for me personally, I could say that the frustration with my coworker, with my boss, and with my workplace is because it's your work environment. So we kind of like categorize things, right? And so I'm one person at work and I'm another person at home, right? But I feel like the home, like the mom, Trisha, is the person who's in the room with the patient, right? But when I come out of that room, then I become the work Trisha. And you do it without even realizing you're doing it. Sure. But you compartmentalize because you're at work. And so you're function over feeling, right? And so maybe we just need to kind of put a little bit more feeling into the function.
It could work.
Yeah. We could turn that into the name of something.
Yeah. We have to work on that one, Kevin.
Yeah.
Okay. This has been an excellent discussion, and we are getting towards the end of our time. But before we conclude, do you have anything else you'd like to, share with the audience, or pearls of wisdom? You've shared a lot, so it's been awesome.
No, I just think we do want folks to also focus on the way they do their work, not just the mental, but also the physical. So I don't want us to focus on something and get distracted from one of the biggest problems we are having as a profession, which is all these micro injuries that finally end up causing a chronic loss of function. That is still going on. And so this idea that we are trying to educate our employers, our coworkers, when we're looking at a coworker and we see them doing something that's not right, we need to gracefully say, hey, did you need some help? Like, that doesn't look good. Because I don't sometimes think you can see yourself when you're working. And you get into these pretzel positions because that's just the way you've always done it. And if somebody walks up to you and just says, hey, you know what? I need you to be here. Like, I don't want you to be out of work and I'll have to pick up your work. So could you try to pick up a little bit, or can I help you? Or could I help you do something so that you don't have to get in these awkward postures and positions? So I still don't want us to lose focus on that, because that is a hugely unresolved issue that we have I think our equipment companies are really doing a better job than they've ever done designing our platform. So I want to give kudos where kudos are deserved. I think design of equipment has really helped a lot, but a lot of the remaining things to lower risk sort of are on us, and also the idea of a coworker helping to identify those. So being supportive emotionally also needs to translate to continuing to support people in a physical way. And I think our administrators, our supervisors, unfortunately, are as ignorant about this as they are moral injury. So we got a lot of educating to do, I think.
Right, absolutely. That is
Yeah.
so true. And as many years as we've known about the work-related musculoskeletal disorders, we've come a long way, but there's still a lot of work to be done. And you are so right. Like, you get in there doing an exam and you're just trying to get the job, done right, but you don't realize that you've got yourself in some predicament. And I joke with people about it, but it is true. I just say my entire right side is shot.
Yeah.
From all the years of scanning and long before musculoskeletal disorders were even tied into scanning, but it's like that with a lot of different professions. If you completely, repeatedly do the same movements, you're going to get injured at some point, and it's going to turn into a chronic problem. So,
It's true. It's true.
education is the key.
I used to be the ergonomics police at my facility, and anytime I'd come in the room, all of a sudden everybody would stand up straight or move closer, or because I was constantly. My boss was the worst one of them all. I'm like, you're setting a terrible example. You're literally in bed with the patient laying across them to scan that left kidney. Like, ask for help. But yeah, it's funny because when we were at the FSDMS conference, I had a program director approach me, and she's like, she knew me by name, and she said, "You have a hot tip on ergonomics." And I said, "I do." And Casey was actually my model in that. I don't know if he remembers that, but it was kind of we did it, I think, shortly after COVID started, and just something to post. And she said, "I show it to every student that comes through my cohort." And I was like, really? Well, first of all, thank you, because you're bringing awareness to this issue at the beginning level, and you're setting these sonographers up for success, where they're going to learn it properly from the very beginning and not have to fix what they're doing wrong. So awesome. And then secondly, I just thought it was just amazing that the word's getting out there and people are paying attention to it. It's being integrated into programs. So if you haven't seen that hot tip, I encourage you to go check out our YouTube page and watch that hot tip and share it with your department, because it'll be a nice, gentle reminder of the things we do that hurt ourselves.
Share that hot tip along with that article, and you'll be golden.
Yeah. We'll put it in the show notes for you, so you have all the resources you need to reach out to
That's right.
your staff and your management.
Absolutely.
Yeah.
Okay, well, I think we're about out of time now, so I want to thank you, Kevin, so much for joining us today. This has been an awesome topic to discuss, and very enlightening, I'm sure, for a lot of our listeners that are out there. You're clearly very passionate about this topic, and we're just so thankful that you agreed to join us on the Sonography Lounge today and to share that very valuable information with our listeners.
Yeah.
Thank you guys so much.
Yes, thank you. And we also want to thank our listeners. We just appreciate you guys so much. You've been keeping us going for the last almost 6 years now. We've had this podcast going. And we encourage you, if you have an idea for content, you want to see something that we haven't covered, email us an idea. You can send that to sonographylounge@gmail.com, and we'll be happy to cover that for you. So wishing you all a great day and happy scanning.
Happy scanning.
Thanks for listening to the Sonography Lounge. Don't forget, if you like this episode, please subscribe and leave us a review on iTunes, Spotify, or wherever you get your podcasts. You can also find us on Instagram @Sonography Lounge and Twitter @SonographyLNG. If you have any questions, comments, or topic suggestions, feel free to send an email to us at sonographylounge@gmail.com. Have a great week, and scan, scan, scan.